Good morning. This is Bob Sweeney. I'm the host of the Global Health Impact Network podcast series this morning, and I'll be interviewing a very interesting individual who is the CEO of one of our client companies and is also an interesting human being. As you know, or you may know, I'm one of the founders of Global Health Impact Network, and we're trying to create a series here that will inform our audience about developments in healthcare, particularly in innovation. So I'll stop talking. People are more interested than others anyhow. And I will introduce you to Raja Sundaram, who is our guest this morning. Raja, can you tell us a little bit about you and your background personally, how you got here, where you came from, how did you get to what you're doing today?
Thank you very much for the kind introduction, Bob. My background is I came out of Cisco Systems. And now I've landed in digital health focused on musculoskeletal care. The pathway is as follows. I started the journey of understanding healthcare when I was at Cisco because we were focused on global health presence, which is, think about it as the granddaddy of what is now telehealth. Through it, by partnering with GE Medical, Cerner, and UCSF, I kind of got a better understanding of some of the challenges in healthcare. Since then, spent time with Virgin Hyperloop One, Boston Consulting, and so on. But throughout it, I started focusing on how to enable patients to manage themselves at home. What I found was most of recovery occurs at home. And if recovery occurs at home, and we are sending patients home with 5 sheets of paper to go manage themselves, that just won't work. There has to be an easier, simpler way for them to follow their care instruction at home. And I decided to focus on that. So that's my journey into healthcare.
Very interesting. And how did you come to Plethy? Or tell us about that company, how it got started, and your involvement with it.
I'm one of the co-founders of Plethy. I started working alongside a surgeon who was earlier a neurosurgeon who was at Stanford and a leader in healthcare. When we started this company with the emphasis of managing patients at home, clearly didn't have any solution to take to market. So we didn't come up with a solution looking for a problem. We spent the first couple of years while I was at Hyperloop One really talking to hospital CEOs, CFOs, to seek to understand financially what challenges they face, and with physicians of various denominations seeking to understand what problem to solve. And throughout it, we kind of came up with this notion that the hardest thing to get a patient to do is to do exercises at home for recovery. Clearly, as you know, it's not just musculoskeletal, all the way from congestive heart failure to pulmonary recovery and so on, requires doing home exercise programs. That's the hardest thing to do. So we decided, look, why don't we make it simpler for patients to manage their care, including doing exercises at home? And the focus, therefore, was musculoskeletal as a starting point. So that's the journey of how Plethy got created and how we came about this. We are a team of both healthcare professionals and tech executives. So we are a geek and a Greek squad. And all we have done is digitize care protocols and ensured it's simple for patients to follow.
What is it that makes Plethy distinctive? I mean, there's plenty of people out there in the world who are innovators and healthcare personnel who are trying to do the very thing you're talking about. What makes your approach different and advantageous?
3 things for us that differentiates us. The first is clinical outcomes and the technology that delivers it. The second is simplified patient engagement. And the third one is simplified clinic engagement. So let's kind of break that down. From a technology standpoint, it was very important for us when we started thinking about musculoskeletal that we are able to address all musculoskeletal conditions, be it surgical or non-op. It was also important for us to address all the major joints in the body, all the way from your ankle, knee, hip, lumbar cervical, lower back, shoulder, elbow, wrist. But to do that requires tracking movements and range of motion in every joint in the body. And that's what makes us unique. What we deliver is really high quality clinical outcome to the patient. We are not a wellness device. And that means that we had to run through cohorts of patients, joint by joint by joint, to make sure it was effective. The second part is patient engagement. Just because we have a cool platform doesn't mean if you build it, they won't come, or they won't stay on the platform for a long time. So we put a lot of emphasis on seeking to understand across a diverse range of patients, from high school kids to someone who's over 90 years old, how to keep them engaged and motivated in the platform, which takes us to two parts. One is simplicity in terms of how the programs work for the patients to do it 2 times or 4 times a day. And the second is how we drove behavior and built that into our app. So our entire app and our entire engagement on our coach who speaks with the patient understands both persona, tendency, socioeconomic condition, what motivates the patient, what drives the patient. And our entire engagement, be it our coach or the app, is psycholinguistic. So 2 patients do not have the same experience. It's more tailored to how they want to learn, how they want to be coached, how they want to be motivated. And the third part is clinic engagement. Look, we all know that MDs are very busy. We all know that their PAs and their NPs are very busy. We also know that their MAs are very busy. So just because we have an interesting platform doesn't mean that it's easy. It would be easy for them to adopt. We spent a lot of time really looking at business process inside clinics and completely made it turnkey for them to go implement it without much disruption into their existing workflow. That's the 1, 2, and 3.
I'm curious as to how the insurance companies and reimbursement sources look at this enterprise. Are they favorable to it?
They're more favorable to it than they ever have been before. And the journey started really a little in 2019, a little bit more in 2020, and really evolved in 2021. Here's why. One of the biggest issues in healthcare is longitudinal visibility into what the patient is actually doing. We all know of cases where we've been given exercises to do. We go back to our physical therapist or our orthopod, and they ask us, "Did you do it?" And we all say, "Yes, we did," knowing fully well we haven't. The question really is, this is not about surveillance to make sure that they are doing it. It's about really having recovery metrics all throughout the episode of care, and at the same time ensuring if intervention needs to be done, there's heads up to do it sooner rather than later. And the only way to do that is to monitor someone in what they're doing and how they are progressing in their recovery cycle. That's really why insurance is interested in it, because for the first time, when you say a patient has good quality outcomes, it is quantifiable. It's metrics. It's data.
I would imagine that some of the larger medical groups in the orthopedic specialty would find this solution of interest. Can you tell us a little bit about that?
There are 2 drivers that motivates. Look, doctors really want to ensure patient outcome is of high quality. Today, the mechanism for them to ensure that occurs is one of 2 things. Let's take a surgical case as an example. Someone got their knee replaced. The ortho gets to see the patient once or twice or 3 times post-surgical on an average. And that's all spread out 4 weeks, 6 weeks out. Throughout it, they still want to ensure high quality outcomes, which means they're dependent on the patient doing what they're supposed to do in their care protocol, and for the patient to go to their physical therapist on time and recover. What we are enabling is patients to go manage themselves, whether it's a surgical or non-surgical case, whether it's a orthopod or a pain specialist or a primary care provider, to ensure that the patient is indeed doing what they're doing. Along with it, the fact that they are being monitored gives the doctor the opportunity to intervene or change the care plan quicker, faster. So they love it from that standpoint. The second part is an economic proposition, which is the incentive system for physicians has always been about engagement with the patient, and this supports that. So it's reimbursable in remote patient monitoring. In addition, if they are in a bundle payment, this lets them ascertain with data on the progression of the patient what are the right set of services to prescribe. So it's a database decision on the patient progression that the physician is empowered to make for the first time. That's why they love us.
Well, I'm also, while you were speaking, I was thinking that there must be I would think there would be a strong application for this kind of solution in the HR area. Workers' comp, for example, is a very costly expense for businesses in the United States. Do you have any play in that area?
Oh, we are well underway in that journey, Bob. I'm glad you asked me that, because the same musculoskeletal issues are the primary issues when it comes to employee, right? And so we are in workers' comp market with a payer, with large enterprises. And the focus there is about giving the employers the opportunity to give their employees the right set of tools to successfully return to work. Because the quicker the employee returns to work, the higher the productivity is for the employer. The ROI model is extremely strong. So the employers are beginning to embrace digital health to augment the physical service that is being provided to the employees to accelerate return to work. And the payers in that space are also eager to understand how engaged the employee is in returning to work, how motivated, ensuring that they are motivated to recover quicker, faster, and return to work, and then having quantifiable metrics to really ensure that the employee has indeed recovered. Otherwise, the risk of re-injury is very high, right? And so in workers' comp, we are looking at it, we are entering the space in two areas. One, in workers' comp itself, and the other is where there's a small strain or a sprain. Think about it as musculoskeletal discomfort. So we are in both arenas.
So I would also imagine that it would give an employer some comfort in terms of predictability to know what the potential outcome is for an injured employee. Is this something that's going to be fixable? Is it something that's going to lead to a return to work? Or is it something that might lead to a litigation or a settlement of some kind? Just the predictability, I would think, would make it a benefit, wouldn't it?
It is. It's the real-time data. It's the data on the engagement of the employee, and it's data on the recovery of the employee, which is what the claims managers and the third-party administrators are eager to seek to understand. Because of what the problem that doctors face in healthcare, which is the last mile real-time telemetry of what the patient is doing at home, is the same problem in workers' comp. And that's the problem that we are addressing.
So tell us a little bit about the range of specialties or applications where Plethy is an effective solution. Yeah, I know orthopedics, obviously, but where else can you imagine the solution working well?
Where we are today in the marketplace is with our focus on musculoskeletal. We are in orthopedic groups. In healthcare, we are in orthopedic groups. We are in pain clinics and in primary care network, IPAs.
I see.
On the enterprise space, it is the risk manager as a buying center for workers' comp.
How has your solution, how has your company appeared to the investment community? You know, you can have a great idea, but if people don't fund it or put money behind it, it may just be a good idea and never go anywhere. Tell us what your experience has been there and what your expectations are going forward in terms of financial backing.
So our focus at the onset has been in terms of having investors who really understand what our journey is, who understand the benefit of data and the determination of patient engagement and outcome. So Global Health Impact Fund has been a fantastic partner because can't get any more, as they call it, street credit, because the due diligence was done by physicians and by healthcare executives on the tech side who are managing cloud platforms and so on. What we found as we continued down the journey is the right profile of investor is one who understands that healthcare is a societal problem, and here's how technology can help benefit healthcare. And there also happens to be people, and even if they're not interested in healthcare, the people who understand the power of data, because after all, we have historical data of the patient, clinical data of the patient, and behavior data of the patient, all of which leads itself to be conducive to big data analytics and predictive models, which is where we are. So it's a combination of folks, people who are either in healthcare, understand the power of data, or people who are not in healthcare, who understand the power of data and how big data analytics can change a business model of an industry. That's the real problem. That's the profile that we look for, and that's who we speak to.
Fascinating. Well, we've kind of covered the broad strokes here with you this morning, Raja. Is there anything else you want to tell us that I've left out or haven't touched on that would be useful for the watcher to know?
It's not necessarily about Plethy, but it's about the trend in the industry. The challenge that digital health is looking to solve, whether it's us or someone who's focused on pulmonary or cardiovascular or cardiothoracic or any of the other fields in medicine, is this. As we grow older and live longer, the need for care is only going to increase. It's a supply-demand problem, which means most of the care, there aren't enough care providers to be able to deliver against that, which means empowering patients to manage themselves is going to be key in every form of medicine. And if that's the case, then my challenge to your listeners would be, how can you support this cause? Or if you're an entrepreneur, how can you make it simple for patients to take care of themselves? And to healthcare, it is about quantifiable metrics that deliver clinical outcomes. And what we have to begin to start thinking about quantifiable outcomes, I'm going to use musculoskeletal as an example because I happen to play in the space, is about looking not only at the height, weight, BMI, but to begin to start looking at ethnicity. Because once you do that, and this gets interconnected, you're now really getting into real-time risk stratification of an individual and towards the path of personalized medicine. That's the journey that many of us are taking in the space. And I would ask your listeners to figure out how they can play a part in enabling this journey.
That's pretty impressive, Raja. I thank you for the overview. I thank you for the perspective on taking care of yourself as you age, since all of us are doing that. And I wish you the best in achieving your goals, both clinically and commercially. Thank you very much.
Thank you so much, Bob, for the opportunity. I really appreciate it.